Hi, it's Kim. Today, I wanted to talk to you about diabetes, focusing on type 2, and specifically in the context of dental settings. Many people have heard about diabetes, but complications of diabetes in the oral cavity are less well known, despite gum diseases being the sixth most prevalent complication. I'll be explaining what type 2 diabetes is, its manifestations in dentistry, including the symptoms and side effects, before going into all that lifestyle factors which help reduce risks and manage this disease. Diabetes is a disease when your blood sugar levels or your blood glucose levels are too high. We get glucose from carbohydrates, which are broken down into simple sugars through our digestive system. Amylase, which is found in our saliva, can break down complex carbohydrates to glucose. Glucose levels in your body are maintained by insulin. What is insulin? Insulin is a hormone produced by beta cells in your pancreas that helps lower glucose levels in your blood. Once glucose is inside the bloodstream, insulin signals cells in your body to absorb the sugar and use it for energy. Insulin also signals the liver to store blood sugar for later use. There are two types of diabetes. Type 1 is genetic, with patients' bodies not being able to produce insulin. However, type 2 is far more prevalent. This type occurs due to a combination of genetic and lifestyle-related factors over time. Although insulin is produced, not enough is produced due to diminished beta cell function and/or mass, and/or the insulin produced is not used effectively. So this results in high glucose levels in the bloodstream, and that leads to many disorders of the circulatory, nervous, and immune systems. There's a strong correlation between type 2 diabetes and obesity as well. Being overweight, inactivity, family history of diabetes, and older aged people are some of the risk factors for type 2 diabetes. Amongst many complications due to type 2 diabetes, various inflammatory diseases and soft tissue pathologies in oral cavities are also a symptom of diabetes. Periodontitis and gingivitis are some of the gum diseases that can result as complication. Gingivitis is a mild form of gum disease with irritation, redness, and swelling, inflammation of your gingiva or your gums. Gingivitis occurs because of bacterial buildup on your teeth and is a result of poor oral hygiene and possible underlying diseases such as type 2 diabetes. Without proper treatment, gingivitis can progress to a more serious form of gum disease, periodontitis. Periodontitis is more serious due to the damage to the actual teeth and or the bone that supports your teeth. It's irreversible and quite severe if not treated. The symptoms include gum inflammation, bleeding gums when you brush teeth, bad breath or bad taste, and receding gums. So the main difference is that gingivitis is less severe and is reversible, while periodontitis is more severe and have progressed from gingivitis and can be irreversible due to the teeth and bone damage. Dentists treat gingivitis by removing any plaque and tartar buildup. Correct teeth brushing technique using a soft bristled toothbrush can also be demonstrated by the dentist, which helps prevent any further buildup. For periodontitis, treatments can range significantly depending on its severity. Non-surgical treatment options include scaling to remove the plaque and tartar, root planing, which smooths root surfaces to discourage further buildup, and topical antibiotics can also be administered to control the bacterial infection. More severe cases may require a visit to the periodontist. If gums have receded, soft tissue grafts may be necessary. And if there's any bone destruction, then a bone graft may be required. Although there are many treatment options available, there are diet and lifestyle factors which reduce the risk and help manage type 2 diabetes. The Australian Dietary Guidelines recommend that we eat a variety of nutritious foods from 5 main food group categories: vegetables, fruit, grain and cereal foods, lean meats and poultry types, dairy and alternatives to dairy, and obviously to drink plenty of water. They also recommend to limit the intake of foods containing saturated fat, added salt, added sugars and alcohol, which is what we've been hearing this whole time. And from the Australian Government Department of Health, adults should aim to be active every day and try to get either 2 to 5 hours of moderate intensity physical activity or 1.25 to 2.5 hours of vigorous intensity physical activity each week. Thank you for watching this video. I hope it helped give a clearer picture of how type 2 diabetes presents itself in dentistry. If you've enjoyed this video, don't forget to leave a like, comment, and subscribe. Thank you.